Why won't my child poop? That's the question a lot of parents are going to ask when their child is bound up with constipation. Now, that could be different from a baby all the way up to a toddler and adolescence. So I have some answers for you, but I know that there's some frustration with this and frustration with the child as well. And what you naturally would do is we go to a doctor. A medical doctor is going to say, get him on MiraLax. It'll help the poop. It's going to bring water into the colon and it'll flush it out, easy as can be. But the problem is you find yourself constantly giving the MiraLax over and over and over again. And if it gets to the point where a toddler, the MiraLax isn't working, suppositories are there, which are not comfortable for the child, not comfortable for you as well, but you're going to do anything you can just to get the child to poop. And as a child and a toddler, if they have one bad experience pooping, boy, watch out. It becomes an emotional reaction where they do not want to poop after that as well. So you have to make it soft, and you may introduce citrate, which will soften the stool as well, and then hide it. You might even be recommended the P diet, which is pears, peaches, plums, prune juice, all those things to help get the body moving and get this flushing again, and introducing fiber too. But I am going to tell you there is a different way, and I've seen many people with many toddlers included with issues with constipation, where all of a sudden it just turns off. And so what we look at is we're looking at it starts up here in the vagus nerve. Vagus nerve helps digest food in the gut first, and then the mid-back, the nerves in the mid-back will help move digestion through and push food through. If you're stressed in any way, if you have anxiety in any way, well, the nervous system is going to shut down the digestive system. They're saying, can't digest food right now. I need to divert energy towards muscles. And so if a child's nervous system is stressed, digestion system just shuts down. So think about it. Do you ever feel like eating a peanut butter and jelly sandwich when you're nervous or before you have to sing in front or talk in front of everybody? Absolutely not. So what about them being nervous all the time and having a queasy stomach? It's just the food doesn't pass through. The muscles aren't going to work as properly. And then the lower body, where we find a lot of problems, is in the sacrum, the tailbone, where those nerves, they can't squeeze the poop out. They're just muscle. I mean, think about using your tongue or using your lip after you get Novocaine in your mouth. You know, you're sitting there talking, you're wondering if you're mumbling, or your hand if it goes to sleep. Well, that's what a rectum feels like. If the nerves aren't firing correctly, it's just numb. It just can't not get the energy it needs to expel the bowel movement that it's supposed to. So what am I going to look for as a chiropractor? I'm looking at how the juice gets to that digestive system. How do we get that moving again? And so oftentimes we see issues even in the upper neck that controls this, in the mid-back definitely, and for sure the sacrum. We see oftentimes in a physical exam the hips are really torqued, meaning it'll appear like one hip's higher than the other when they're standing. So that's a good little test to do at home and see if your child is constipated, to check and see if one hip's higher than the other. Just put your hands right on the hips, on the top of the hips where the bony part's on along the side. And if that's a torque, man, that's a clue right there that something is not right and something's not jiving really well with those nerves in the sacrum too. Now, what I'm going to suggest to do at home, definitely do the P diet. You know, there's alternatives to MiraLax. You look at Facebook pages, man, they are loaded with like anti-MiraLax. There's side effects. I can tell you firsthand what it looks like because I've seen it. I've seen kids throw fits. I've seen the pounding of the fist when they can't go poop. I've been there, I've seen it. It is miserable to watch. So you're gonna do anything you can. If that's the case, you need to, obviously make your best choice, but realize there's other options. Mag citrate is one, it's sweet. It's what they use for sweeteners a lot of time in foods. But also look at the nervous system, and if you need answers from that point of view, if you're at your wit's end saying, what can I do? What can we do to get over this? By all means, I'd love to be that answer for you. I'd love to help your child make this pass so it can be much more enjoyable too. Now, if you do have any questions, I'm here for you. Kindly give our office a call. I'd be talking to you personally. Make sure that chiropractic is the right fit for you, and then we can answer any questions of what they explain the process is. Until then, have a wonderful day. God bless.